Okay, let's smile. Let me take one photo. Okay, smile. Here you go.
Okay. Good afternoon, ladies and gentlemen. It is time to begin the anniversary special lecture from President of ELSA. My name is Kyung from Soonchunhyang University Hospital in Seoul, Korea. It is great honor and happy to share this special lecture. This anniversary lecture is from President of ELSA. As I told earlier, ELSA is endoscopic and laparoscopic surgeon of Asia. I'm so happy to introduce Dr. Suthep Udomsawaengsup to participants. He is president of ELSA and one of my best friends also. And let me introduce Dr. Suthep briefly. He is associated professor of surgery at Chulalongkorn University in Bangkok, Thailand, and he has a lot of titles of president of Medical Society. He was ex-president of Thailand Hernia Society. Now he is president of Laparoscopic Endoscopic Surgeons of Thailand and Endoscopic and Laparoscopic Surgeons of Asia. And he will be the president of APMBSS. APMBSS is Asia Pacific Metabolic and Bariatric Surgery Society. Today, he will give us a lecture titled Roadmap to Bariatric Surgery, Reimbursement from Korea to Thailand Experience. Please.
Thank you very much.
Good morning, friends, dear KSELS committee and friends. On behalf of ELSA, I would like to congratulate KSEL for the 25th years of excellence. Your hard working and great contribution will be cherished. My talk today will be a roadmap to bariatric surgery reimbursement, experience learned from Korea to Thailand. The 25th year of KSEL would be a great celebration. Congratulations, KSELs. On behalf of ELSA, I also would like to bring our best regards from ELSA members to KSEL for their 25th year of anniversary. And also, I would like to thank KSEL for being the greatest support to ELSA 2019 in Chiang Mai, which has been very highly successful. I myself missed the opportunity to visit Korea, so what I would like to say is I saw you. I miss very much. I choose this topic to celebrate the 25th year of excellence of KSEL because it's an experience learned from Korea Society to Thai Society for the reimbursement of bariatric surgery. It's all my team from King Chulalongkorn Bariatric Metabolic Institute. It's our new office and clinic. Let's have a look on the bariatric surgery in Korea. It started in 2003 with Professor Kim has been doing sleeve gastrectomy. In the same year, following with Dr. Kim, Dr. Lee, and Dr. Choi for the room-wide gastric bypass, as well as Dr. Kim for the gastric bypass, following with 2004, where Dr. He started adjustable gastric bypass. Then, in 2009, Dr. Kim and Dr. Hill have started sleeve DJB, and in 2011, my good friend Dr. Do Jung Park started robotic assisted room-wide gastric bypass. We have a look on experience in Thailand. We started in 2003 with the long-wide gastric bypass, following with the adjustable gastric bypass. Then 2007, we started sleeve gastrectomy. If you have a look on the development of the society in Korea and in Thailand, the Korea Society for Metabolic and Bariatric Surgery started in 2010. We in Thailand, we have formed our Thai Society for Metabolic and Bariatric Surgery in 2008. In 2014, in Thailand, we have the APMBSS 2014, and also in 2015 in Korea for the APMBSS 2015. Then Korea has been doing a wonderful work in having approval for the reimbursement in 2018. We just started this month for the reimbursement. All our experience has been adopted and also learned from a Korea society. So this is what we have done, the roadmap to the reimbursement. What we have found was that the public awareness is more important. So then we have several activities to give the public the awareness and also the truly understanding for the bariatric and metabolic surgery for treatment of the diseases. So this is the Asia Obesity Walk in 2017. And also our team has been very much involved in the public announcement and TV program for the experience of bariatric and metabolic surgery. What next that we are focusing on would be the bariatric surgeons as well as the multidisciplinary team. So what we have done, we started in 2006 that we have the bariatric training in South Kadawa. It's very good that we have our friends from all around the world to come and give the experience and transfer the technology experiences into our team, local team. So we have done tons of hands-on workshop focusing on bariatric and metabolic surgery, as you can see. So Kadawa give very much a good example for the participant to be incorporating all skills and steps before we start in our patient. You will see that every year we have 2 or 3 workshops. And finally, in 2014, before the APMBSS meeting in Krabi, we have the workshop at Chula. Even during the hard time of COVID-19, it started last year that we turned all our workshop to the Telementoring Workshop. And also I would like to thank KSELS for giving us the collaboration, giving the mentor to be sitting in Korea, and we can do the workshop at Chula in Thailand. Multidisciplinary teams also very much important to ensure that the patient after having the treatment would be adjust and being comfortable with the treatment, and also to assure the result of the treatment. So we've been very much focusing on multidisciplinary team. Then this is what we have. You can see that we have almost all the surgeons cover the country of Thailand, and both in private, public, both in the university and the services facilities. One of the most important, and we have to be working very hard on, was the cost of the treatment. So then this is the chronological development of the health insurance system in Thailand. And then you can see that separate into sectors. First one is private formal sector. So we do have the social security offices to take care of all the employee. The second part is the civil servants medical benefits scheme, which also I myself have been taken care by this government employee system. The last system that been adopted to the people to cover all those who haven't have the coverage, so called the universal coverage scheme. So then if you have a look on these three insurance coverage, I myself included in the government employee, which the smallest part of the people of 6 million, following by the private formal sectors, which is 12 million. The most important, also the biggest part, would be the universal coverage. So then when we are discussing about having the payer to be considering for the bariatric surgery coverage, so we've been working very hard into this part. And also we do have the private health insurance incorporated into the system, which also very much helpful in strengthening the system. Then if we would like to have the payer to be taking consideration, we're also having to do several studies. One of the most important would be the cost of bariatric therapy. So we run the pharmacoeconomic evaluation of the treatment of bariatric surgery, cost and the outcome. So this is the Markov model that we've been applying for those who have bariatric surgery versus no surgery, and then we calculated. Finally, we published the study that you can see that it's been proved that it's got effectiveness for the bariatric surgery, the study, especially for diabetes patients. Then with all the data and evidence base, we had shown earlier that we have our Thai Society for Metabolic and Bariatric Surgery, which has been founded in 2008. It's been working very hard doing the guideline as well as talking to the policymaker. Last year, we have several online and then webinar, try to get ready for the reimbursement to be applied. Even during the hard time, we're also having several webinars. Then we have a meeting in our society, and we have our clinical practice guideline. This guideline is very important for all members to be following with. And with this guideline, that would be very much important for the reimbursement. Finally, after we've been discussing with the policymaker, the payer, several times, we have had the reimbursement for bariatric and metabolic surgery got approval, started from the 1st of this month. So all experience and the roadmap has been very much learning from KSELS friends. That's why today I would like to thank KSELS Korean friends for the experience sharing and the collaboration that we have been done. So to conclude my talk about roadmap to bariatric reimbursement, the experience from Korea to Thailand. The bariatric medical research is gaining more acceptance. Fellowship programs being established. Multidisciplinary team is applied in all centers. The most important is that the health promotion and public awareness has been very much emphasized. And finally, the reimbursement for bariatric and medical research in Thailand has been effective since the 1st of April 2021. I also would like to take this opportunity to invite all friends from Korea and all MIS bariatric medical friends to join us for the APMBSS 2023, which will be held in Rayong, Thailand. Rayong is located in the east coast of Thailand. It's beautiful beaches. And we have both Suvarnabhumi Airport or Udomsawaengsup Airport, which located in Rayong. From Suvarnabhumi, it would take about 2 hours to get to Rayong, but from Udomsawaengsup Airport, it would take 30 minutes to get to Rayong. So last, on behalf of ELSA and ELSA governor, the exclusive committee, as well as member, I would like to take this opportunity to appreciate KSELS for hard work and contribution that KSELS has been initiated and contributed to the field of MIS. Please cheer for KSELS for the Silver Jubilee. Thank you very much.
Okay. Okay, thank you very much. Very impressive and interesting. And usually the roadmap is a strategic plan to achieve a goal or desired outcomes. I think this lecture is rather historical review of bariatric and metabolic surgery, both Thailand and Korea, than roadmap. Okay. Anyway, thank you very much again, and very much for interesting lecture. At the moment, we don't have any question or comment for your lecture. Is there anything to say to audience, Dr. Suthep?
Thank you. Thanks, my good friend. Dear all KSEL friends, first and again, I would like to congratulate KSEL for your excellency of 25th year. So if comparing to human being 25th years old, I think it's very well organized and very much energetic. And it has been shown in the past that KSEL has been working very hard in promoting and also giving the evidence base in MIS. So I think all society, especially the local society, including ELSA, which we are friends for a long time, actually, we've been working very closely. So that's why in this occasion of celebration of 25th years anniversary, I choose part of the experience. Yes, it is part of the history to compare. That's why we developed the actually laparoscopic treatment for one particular diseases. For instance, the obese and metabolic diseases. But anyway, this collaboration and also this contribution from KSEL friends is including all fields of MIS. We don't have to talk for all, but we experience and we evidence all effort that KSEL has been contributing to the field of MIS. And also what I would like to congratulate to KSEL is that right now KSEL is a member of ELSA. This is a wonderful achievement that I would again congratulate for the membership of ELSA. And soon we will be together again for KSEL and also for the World Congress, which will be soon going to Korea. So all friends, I miss you so much.
Thank you so much. Wow, as conventionally, our Congress has proceeded without any question or comments. So now it's time to finish this session. Thank you again, Dr. Suthep, and all participants for joining us together. Thank you.
감사합니다. Thank you very much. We'll see you in person soon. Cheers.
Okay, bye-bye.